Hello, everyone. I'm Dr. Renee Mehrra. Thank you so much for watching Zoom in with Renee. Today, my guest is Dr. Abha Agrawal. She's a physician and a healthcare executive for over 2 decades. She's a chief medical officer at the Humboldt Park Health Hospital in Chicago. She serves on the board of two major healthcare organizations in the United States. She's on the American Board of Internal Medicine and on the American College of Medical Quality. She's the founder of A4 Clinics in India. It's a chain of robotic neuro rehab clinics and brain stimulation centers. Dr. Abha is also an author and editor of two books on patient safety. And today I'm going to be talking to her about some important topics in our healthcare industry in the United States. First, let's talk about artificial intelligence and its impact that is on medical field. So let's talk about first about the pros, and then we'll go to the cons. We know that pros, they are targeting new pathways and trajectories in patient care, disease management, also looking at inclusion criteria for clinical trials in many diseases such as cancer, and also unstructured health data. That's a big issue right now. So here we have an artificial intelligence, and I want you to share more.
Thank you, Dr. Mehrra. It's such a pleasure to be here with you. You and I have known each other for a long time. And
very long, from the time you were the chief medical officer at the Health and Hospitals Corporation in New York, Kings County.
So I am just thrilled to be talking to you about artificial intelligence and what it can do in healthcare and what is its promise and what are the patterns. I can tell you personally, I'm very, very excited about what AI can do in healthcare. You know, AI has been around for quite some time, but no question, since ChatGPT came out in November of 2022, it has really burst into everyone's consciousness, and it has triggered a lot of conversation about AI. Why I'm so excited about it is the following, because healthcare is a very complex business. Healthcare is very information intense business. You know, healthcare, medical literature and medical knowledge doubles every 73 days. So it's practically impossible for anyone in healthcare, whether it's a physician or a pharmaceutical researcher or a clinical trials person, to keep up with all that medical knowledge. So what a technology like ChatGPT has done, it has the ability to constantly look at the entire corpus of medical literature, continuously glean information and knowledge from that, and provide it to us at the click of a button or at a single prompt. So there is extraordinary ability for it to help us as healthcare providers, as medical teams, as physicians, to give us the information we need at the click of a button. However, there are many, many concerns around that, where it's not ready and mature yet, or maybe it will never be, where it can replace humans. So my view of ChatGPT and AI, it's human plus AI should be greater than human alone. But it is never that AI is greater than human alone, right? So I consider it as a cognitive partner, or more like an augmented intelligence, to help us do the right thing for the patient and to stop us from doing the wrong thing for the patient. And that's what I'm so excited about.
There could be a lot of issues if it's just AI and ChatGPT. So what you're saying, it should be augmented with human intelligence, because there could be some errors that can happen.
Exactly. So, you know, let's talk about some good use cases, and then maybe I can talk about where are the risks and where we need to have some guardrails before we use AI in healthcare. In terms of use cases, let me use some examples that, you know, perhaps would resonate with you or with your listeners. So one example is, you know, it's a common medical problem that patients develop a stroke, which is like a brain attack, right? There's a blockage in the blood supply to the brain. And when that happens and patient presents in the emergency room, their neurological outcome is greatly dependent on how quickly we can get to them those clot busting medications, or TPA, how quickly we can open up the blocked blood vessels. And one requirement for that is doing a CT scan of the head. So the earlier, the sooner we can get the reading of the CT scan of the head, the sooner we can take treatment on the patient, and then the better the neurological outcome, right? So in the sense that whether the patient will be able to walk or will they be able to talk for the rest of their life. So it's a very high impact thing. Typically, even in the best case scenario right now, it takes about 25 minutes for the CT scan to be ordered, to be done, to be read, to be communicated back to the ER physician from the radiologist. And then, so that means we have lost this time. What AI can do, and this is is being used as we speak, is within 1 minute, it can read the CT scan automatically without intervention of human and can tell you whether there is bleeding inside the brain or there is clot inside the brain. And within that 1 minute, it can read the CT scan and send an automatic alert to the ED team to say, hey, there is a bleeding, take the patient to OR, or there is a clot, give the patient some clot busting medication. That I'm very excited about, because if we can do it within a minute, then you can see how much impact it's going to have on patients. Let's use another example. As you know, colon cancer screening is a standard preventive practice, right? Once a patient reaches at the age of 50, we say you should go and get the colon cancer screening done, because if we can detect the cancer potentially at a very early stage, at a polyp stage, then we can remove them and prevent the patient from developing cancer. So what they have found is when the gastroenterologist is inside the patient's bowel and looking at it through the scope, AI can help them detect the polyps significantly better. So imagine if I'm that gastroenterologist, or if I'm that patient and my doctor is doing that, it would be lovely to have a little intelligent agent, assistant on my side to say, hey doc, do you want to look at that area, because there may be a polyp there, and that I might actually prevent somebody from getting cancer sort of down the road. So these are how, I'll use one more, a different type of example. You are very much attuned, Renee, with what's going on in the world these days with the peoples and their well-being. So one of the major issues we are facing in healthcare is the workforce. Not only the shortage of the workforce, but burnout. There is so much dissatisfaction and discontent and burnout among nurses, but also among physicians. So, and if you talk to physicians and, my colleagues, myself, there's a lot of burnout related to the crushing burden of paperwork and documentation, right? A lot of doctors will tell you they spend 60-70% of their time, a visit time with the patient, more on the computer and on the paperwork as opposed to actually talking to the patient. They're not happy about it. They don't want to do it. We as doctors, we want to spend time with the patient, and patients want the same thing. So what AI is able to do right now is, if we call ambient AI, you can put AI in the background. The patient and I are talking in the exam room. I'm doing the physical examination, having a conversation. And AI has intelligence enough, because it also knows who the patient is, what their background information is. As soon as I get done, I don't need to now spend a lot of time on the computer. I can focus on the patient, connect with them, be a good doctor. And once I get done, AI will create a note for me, a medical record chart note for me. It will create a visit summary for the patient. It will generate code for the coders. If I have advised a procedure, it will generate procedure instructions for the patient. So those are the kinds of things that they can be extremely helpful.
Early intervention, more prevention over here for disease management, reducing medical expenditures. I think these are really good, assets. Are there any other risks that are involved, especially when we're talking about patient safety, health information technology?
Yeah. So risks are there, and risks are significant. So let's talk about a few risks, some that are very, and in any application there is risk, but definitely we have to be extremely cognizant, because in healthcare, we are literally dealing with patients' life and their health. So one of the things that you will talk to people is actually a funny name. It's called hallucination, right? So AI will hallucinate. And what that means is very simple. So when you ask ChatGPT something, what is it ChatGPT doing? ChatGPT is what they say, it's a large language model. It basically is sort of a next word predictor. So what it has done, it has taken all the knowledge that's available on the internet, medical or otherwise, and when you ask it a question, it goes into that whole corpus of knowledge and say, hey, based on this is what I think the answer is. What it does is when it doesn't know the answer, it just makes things up. What's called hallucination. So it can give you a completely fabricated answer, completely wrong references, completely made up, truly artificial references that don't exist anywhere. And it will do so in a manner that is so convincing. So right now, if I cannot use it to do my primary literature search and based on that, practice medicine, because it can give me a completely false answer. Now, I can use it as an assistant for myself to say, hey, I think these are 2 good literature articles or 5, 10 good citations. Let me go and research so that I can work on this. But I would very strongly say that whatever ChatGPT says, it can actually look very good, but it can be very false, actually. I don't know if you know, there was actually a case, a lawyer, where this is a real case. They were fighting an airline and they asked ChatGPT, and ChatGPT wrote an argument and gave its precedent and the case law, which was completely wrong. And the lawyer actually, the judge said,
so do you have to reprogram it to get a second opinion? How does that work?
So you can ask it questions, but then you have to use your judgment to say, I can't say, I've asked, let's say somebody has heart failure or somebody comes to me with pneumonia symptoms, right? I can ask ChatGPT, hey, ChatGPT, these are the symptoms. What do you think it could be? And ChatGPT can give me some possibility. Now, if I were a patient or if I were a doctor and if I were to say, hey, I'm having this, and this, give me the treatment that I should be prescribing to this patient, or I'm a patient, I wouldn't use that because it could give you the right treatment or it could give you something completely made up. So that's one is the limitation in its knowledge and also hallucination. It can convince you that it's giving you the right information. The other major issue, obviously, is that of privacy and security, especially when it comes to health data, right? It's very, you have to be extremely careful that the data at a large scale does not fall into wrong hands. It doesn't go into the dark web. There is so much cybersecurity concern as it is, even without AI. So we have to be very careful that, it does not fall into wrong hands from that perspective. There are some ethical issues, who should use AI and how can, if I didn't prevent people from using it, are they going to use it for prescribing or use it for clinical decision making that they shouldn't? So as a healthcare leader or in your organization, how should you make access available to your provider teams, right? So what should be the guardrails you should put so that nobody can use it for wrong purposes? I mean, I'll give you one other example, which will really literally scare you, but it's possible. So in a non-medical field, the example is, what if it starts to give me recipe for making bombs, right? For bad purpose it has. In healthcare, the analogy is the following. People have pacemakers, right? So pacemakers are all programmed essentially that if it detects the heartbeat is too low or too high, it will set it. And it's a life-saving thing that people have. But it's basically all driven on computer program, okay? And there are millions of people around the world. My father has a pacemaker, right? So I know this. What if somebody, an AI tool, decided to change the programming of the pacemaker on its own? Nobody would even know. If I have a pacemaker, I would just it wouldn't work. My heart will go haywire. It might be life-threatening, and nobody would even know as to what happened there, right? So these are some real potential risky scenarios. So there are organizations that have come up, right? Is there like Coalition for Healthcare, Artificial Intelligence in Healthcare Artificial CHAI, Coalition for Healthcare Artificial Intelligence. And these are the people who are working together with medical organizations to create those policies and guardrails so that we can use it for the benefit of the patients and the society. Having said that, I think this tool is too important, too useful for us not to stop and say, let's not use it. That's not possible. It's not a good idea.
It's a very effective tool, but it has to be used in a very diligent way, addressing those risks, and we know what the risks are. So this
Exactly.
is trying to avoid them for patient safety. So that is very important. But it is there to stay. It's going to become an integral part of our medical, healthcare industry. But looking at the risk, I think the benefits outweigh the risks. But at the same time, the risks are important to be looked at and seen that they should not happen, so that we don't have these preventable errors that can happen. And that takes me to another question, which is unsolved challenges in healthcare. And one of them is preventable errors. And of course, preventable mortalities and affordability and health equity and quality. And you are part of the American College of Medical Quality. So this is a very important issue.
Yeah. Well, you have hit on a lot of extremely vital questions for healthcare in the United States and around the world. So let's take you are absolutely right. Like you said, if we survey the landscape of healthcare in America today, we have a lot of challenges that we have been trying to solve for some time, but we have not really been particularly successful. So let's talk about a few of them. Preventable harm to patients. That's something that is extremely dear to my heart. When somebody asked me, what do you do? I said, at the end of all of it, I'm essentially a patient advocate. If I have to describe my life as one vocation, one profession, that's what I am. I'm a patient advocate. So right now, if you look at around the world, 3 million people die of medical errors every year around the world. If we look at the COVID pandemic, that's how many people died for 2 years during the pandemic. But those deaths are still happening today. So I call it the silent pandemic that we don't talk about, right? In the US alone, 350 people die of medical errors every year. So actually, if you look at it, it is the third leading cause of death. After cardiovascular disease and cancer, it's a bigger cause of death in our country, but it doesn't get talked about that much, right? 1 in 10 patients get harmed. Our quality is not as good. Maternal mortality in America is worse compared to many developed countries, right? Many OECD nations, if you will. We spend extraordinary amounts of money on healthcare. US is the top spender on healthcare. We spend roughly $4.1 trillion a year. This is more than twice of what other OECD countries spend. We spend over $12,000 per capita per year in our country, right? But we don't get the results because we are very inefficient. So when you look at all of these, we have to say, well, you have to find a way to solve these challenges. Technology is going to be critical. One great thing I want to say, and in 2009, President Obama signed the high-tech bill, which put in $36 billion of investments to create a digital health infrastructure in the country. Every hospital clinic now has electronic health records. So I'm very excited that we have this opportunity because we have these problems. We have a very robust digital infrastructure now, which we didn't have 10, 15 years ago. And now we have an opportunity to create these innovative tools that can help us reduce waste in healthcare, bring those efficiencies in healthcare, and improve quality and cost of care. And that's what gives me a lot of hope. I mean, it's not a panacea. It alone isn't going to solve anything, to be honest. But it can certainly be a good tool to spur innovation and give us newer ways to solve these long-standing problems.
Absolutely. And you started A4 health clinics in India, something very new. They were like a chain of robotic chain of rehab clinics and brain stimulation centers for the differently able and those who have gone through a stroke or neurological problems. How are they faring right now?
Yeah. So this is another thing that's very dear to my heart. India is very dear to my heart. And what I noticed in India is India has amazing hospitals, amazing medical talent, and amazing healthcare. No question about it. If you look at some of the hospitals in bigger cities and even tier 2 cities, they are extraordinary, world class. Doctors are world class. But what I noticed was the post-acute care, especially when somebody gets a neurological illness and they have a disability from that. They cannot walk, they cannot talk. That space was not as well attended to. There were less there was less action, less work being done in that place. So India has a very disproportionately high burden of disability from neurological diseases. And that's something that struck me as we got to do something about it. And also we got to do it in a manner that makes it, we got to bring some advanced technology to India in that regard, but also make it affordable to people. Because we did not want to be where only the elite people can access, your services. So I wanted to make sure it's available and accessible to kind of most people in India. So with that, A4 was born, which is advanced, affordable, accessible, and adaptive to the patient's need. We have 3 centers, and it's been a phenomenal experience doing it over the last 6 years.
Where are they located? Where are they located?
So we started in central India, in Indore, Madhya Pradesh. And then we added the second center in Bhopal, Madhya Pradesh. And then third one is in NCR in Greater Noida. And we are actively looking to add, another several locations. We are exploring Haryana, we are exploring Hyderabad, and hopefully some of those will materialize soon.
So is it a collaboration between the private and public sectors?
So it's right now, it's really kind of a private entity, right? It's a positive social impact entity. We partner with physicians, with local advocacy organizations, some organization like Multiple Sclerosis Foundation. We partner with the seniors, organizations. But we pretty much, it's in that spirit. We have been very good. I mean, was recognized. We received the Make in India award, for this effort in 2017. We are invited to the Global Entrepreneurship Summit when Ivanka Trump was there along with Prime Minister Modi, and she went there as the advisor to President Trump at that time, and was held in Bangalore. And even in Chicago, we have received a number of recognition from US Congressman Danny Davis for this project. So I think it's what excites me about it. It's truly making an impact on lives of one of the most vulnerable communities in our country.
Well, we know that you have been a very effective tech and social impact entrepreneur. And I also want to share with our viewers that Dr. Abha Agrawal, of course, besides being editor of 2 books on patient safety in health information technology, she's also coming out with a new book. And this is really interesting. This has nothing to do with healthcare, but this is actually to do with spiritual health. So it is 13 gifts for my son. You have a 12-year-old son. So 13 gifts for my son for a meaningful life. And you draw the wisdom of the sages and mystics and philosophers from ancient times to even modern day times. And it's a beautiful gift for the new generation, the next generation.
Yeah, I'm kind of speechless about this. My son and I, I drop him off at school every day. So we would be driving in the morning, about a 15-minute drive. and we would listen to radio, and then it was all about Ukraine war and all the reproductive rights and all the racial tensions and all. So we'll turn off the radio saying it's too much. And then, I was going through some, challenges personally, and I was like, so I started to reflect on what I learned in my childhood. I grew up in a small town in Uttar Pradesh, totally Hindi speaking, with my grandparents, my parents, 3 siblings, 4 of us. So in a very traditional, family. And it just, all the things that I learned from my grandmother or my father, and then they started to come to me in Hindi or Sanskrit. And then I started to talk to my son, and then he would ask me some things. And then we will start to talking about the Bible or Martin Luther King or Rabindranath Tagore. I mean, we would go in every possible direction. So those conversations I took, and they became 13 chapters in the book. Each chapter starts with a Hindi or a Sanskrit verse. Kabir Das, Rahim Das, Bhagavad Gita, whatever came to our mind. There were no restrictions, no constraints, literally. And then, I feel very strongly that I want to make sure he has a very good foundation of values to draw upon in his life. And as a parent, you don't control much of anyone's destiny, but you definitely want to impart him I call them my vaccines for him, because he's going to have difficult time in his life. So hopefully these will be the vaccines that will give him some protection and, fortitude, of patience, of forgiveness, resilience. So that's what we talk about in this book. And it's been just a lovely experience, to be honest.
That's the best values you can give
to
son and to all our young generation, because they need those values of forbearance and fortitude, of selfless service, respect for all creation,
compassion and kindness is going
empathy. Yeah, and we don't get that in many times in our traditional blackboard school education. And bringing those value-based curriculum back through your book, I think it's really very exciting for your son. I'm sure he's going to love it. It's going to come out next month, right?
Yeah, it should be coming out anytime now in the next few weeks.
And we'll do the next one that will be only directed for the book for your son, a tribute to your son.
I just want to say that I have and I write it in my book as well in the introduction, I have no expertise on these topics. I have not gone to school reading these. I just felt it in my heart. I wanted to share those sort of emotions and those lessons. They were all informal, very simple, very, very folksy with him. And I have there are people far more knowledgeable and informed, and people who have spent their whole life doing this work. So I definitely had that trepidation as I was writing, but I figured, hey, it's I can write it on a personal level. But I didn't have the expertise, really. You yourself have a lot of expertise. You came to the World Parliament of Religions in Chicago, last month. So you clearly have far greater expertise on these topics. So I would love to have that conversation with you.
Absolutely. One of these days. One is spiritually healthy, one is mentally and physically healthy, and emotionally healthy as well. So I want to leave our viewers with that positive note, because that is so important these days. I've known you for many, many years, and every time there's something new, innovative, and something ambitious, and that is creating so much of impact through your books and through your work and through being on the board of such important healthcare organizations, so we can make some sort of a paradigm shift in healthcare as well as in legislators, so that we have policies that really work for patients and for the healthcare personnel and for physicians and nurses. So thank you so very much, Dr. Abha Agrawal.
Thank you. I really enjoyed speaking with you.
And I'm Dr. Renee Mehrra. Stay healthy, stay positive.